And welcome back to the Morning Blend. Well, if you haven't had the cold or flu yet, you can consider yourself lucky. And if you have, you know that you don't want to get sick again. So what can you do to help?
That's for sure, isn't it? Dr. Madan Kandula with the advanced ear, nose, and throat specialist says you can fight back. That's what you can do.
Give it the 1-2 punch.
That's right.
I like this.
That's right.
Yeah. It is cold, flu, and sinus season. And we were just talking during the break. There are a lot of people, they'll get a cold or they'll get the flu. Instantly it becomes a sinus infection.
Absolutely. Yeah, and it's you know, not everybody's in that category, but for folks that are, it's miserable, you know, and it's sort of, there's sort of two camps. One camp is folks that are always dealing with those sorts of symptoms. They always feel like they have a cold. They're always stuffy. They're always blowing stuff out of the nose, and you know, that's miserable. But then there's another camp of folks that may be fine for bits of time period, but then if they get a cold or they get the flu, then that turns into a sinus infection and they're knocked down for the count. And so, you know, it's a fine balance. Again, if you don't have those issues, it's easy. Everybody's had a cold and knows how just annoying and miserable that is. And if you can imagine being in that spot consistently, you know, or recurrently over and over again, where you just can't get out, that's miserable.
Yeah. Is there something that causes it to become a chronic sinus problem within that person? Because it does seem to be very individual, that certain people are the ones.
Yeah,
like
it's almost always about the anatomy. And so the sinuses are just air pockets around the nose. And so they've all got tiny little openings into the nose. And for some folks, those openings are small or non-existent, basically, if they're shut down. And so folks that have small openings, those are the folks that they get a cold, you know, they're doing okay, and then all of a sudden those openings shut down, and then all of a sudden they're in the heart of a sinus infection. And the folks that have the chronic issues, those openings just always are staying constantly closed, and they're just always miserable. And
so the people who always seem to have sinus problems, and it's truly chronic, that's what happens. Is it's just so small that it's just they're not able to process the bacteria. Okay.
Yep.
So there's probably no magic cure-all for everybody, because everybody's situation is probably different when they get a cold or the flu or whatever. What do you see as being kind of the necessary first step in terms of resolving sinus problems?
Well, if you're in either one of those camps, or you think you might be, so if you're just somebody who's just always in trouble or seems to be in trouble, you know somebody who is, the only way to figure it out is to get it checked out. So the deal with the sinuses, they're tucked away. You can't, like, if you've not had an x-ray of your nose and your sinuses, nobody knows what's going on behind the scenes, and so short of having something like that, you don't know. So if you think you're in trouble, the easiest thing to do is get it checked out. Then we can figure out what's going on. Do you have those narrow openings? Do you have that chronic infection? If those things are going on, then we can kind of figure out, you know, what can we do about that? And there's a variety of things that can be done these days.
Yeah, it sounds like there's a wide range of options. Obviously, I know you do a lot of that. What do you see as typical options for people who have sinus or chronic sinus problems?
Yeah, for folks in that category, it depends what they've done. I mean, so for some folks, doing nasal rinses, and there's certain medicines that can help to kind of keep them off of the edge. But most folks that unfortunately, if they're in trouble, most folks, those sorts of simple things tend not to be the case, and so we have to move up the ladder. And so moving up the ladder conceptually is as simple as, if you've got those small openings or narrow or shut openings, taking those openings and getting them more open. And so these days we can do that in a variety of different techniques. Fairly low key, you know, very targeted approach can make a world of difference for those individuals.
Why do you think it might be important for someone to be evaluated somewhere where you have a kind of a wide range of options, both in terms of how you diagnose it as well as how you treat it?
It means all the world. I mean, you know, basically, if I got 2 options versus 10, you know, if I've got 2 options, I'm gonna try to fit one of those 2 options around you. If I've got 10 options, I can figure out which of those 10 options is the best fit for you. And sometimes it's a combination of things. And so if we don't have the options, we can't give the real quality care that needs to be given. Lots of the options have come out over the last 5 to 10 years. So 10 years ago, we didn't have many options. Nowadays, we've got a ton of options. Key. And so it's nice to be able, from my standpoint, having all those options out there, it's nice to be able to kind of pick and choose based on what I'm seeing in each individual, what I'm hearing based on their story, and trying to figure out, you know, what's going to be the right fit for them. Some people aren't interested in anything, you know, surgery-wise at all. That's just not going to happen, which is fine. I mean, as long as it's a reasonable thing. And so we can kind of figure out it's going to work for each individual.
I know I said during the break, my mom's had surgery, and it's something that changed her life in terms of getting her sinuses cleared up. She still has some problems, but not nearly the same as what she used to.
Right.
I know several treatment options you've pioneered here, and in many cases, you're the only office that offers them. What are some of those treatments that people can look forward to?
You know, one thing on the diagnostic phase of things is the in-office CT scanner, the mini CAT scanner. So that allows us to, in the office, to do a CAT scan of the sinus sinuses, have the immediate information, then we can see those openings. So that's the key with that. So kind of was telling you about before, where it's out of view for most folks, it's in our view. We know exactly what's going on when we have a scan. Then we can figure out treatment options. And then there's something called balloon sinuplasty, which is where we expand the natural sinus openings versus having to remove any tissue there. And again, for certain individuals, that's a real nice fit, real targeted approach, gets to the heart of the problem, gets them pushed past it, fairly low key.
Are any of them covered by health insurance?
Yeah, all that would be.
They are.
Yeah,
Okay.
all of those things. So the the CT scan, all those treatments are covered, which is nice. And so that's not a barrier.
And I know a lot of times you're willing to talk through with people. You said some people are kind of adverse to surgery, talking through treatment options that are less painful, that have very little downtime, less invasive rather than traditional procedures. If you have questions, you can call the people at Advent. Their office is located on North Mayfair Road. The phone number is 414-771-6780, or go to advent.md. Nice to see you again,
Thanks.
Doctor.
Nice to be here. Thank you.
Still ahead, which Packers MV